Hello, this is Mike King, President and CEO of Jewish Home. I'm here today to talk to you about our nursing home Medicaid crisis and why you should care. At our senior living campus, we recently opened an employee grocery store. Close to 50% of our employees are now eligible to receive free groceries twice a month at our new store. You may wonder why we did this. For a while, we have recognized the need to help our staff with the struggles they face due to the rising cost of groceries. Many of our staff members are single parents, sometimes supporting households of 3 or more. They're trying to figure out how to pay rent, mortgages, car payments, daycare, and more. Long-term care workers struggle to meet their financial needs with current wages. New York State does not prioritize nursing home residents and the staff who care for our older adults. Unfortunately, New York State continues to underfund nursing home Medicaid rates. This is evident through the state's lack of adequate funding for staff. Nursing homes are still being paid rates based on 2007 costs, even though inflation has gone up over 45% since then. Long-term care facilities are competing with organizations like Amazon, manufacturing, or retail that can afford to pay higher wages because costs are passed on to customers. In contrast, long-term care facilities cannot unilaterally increase Medicaid rates. We rely on New York State to provide a Medicaid reimbursement system that covers the cost of daily care for older adults and allows us to pay a living wage to staff. You may be asking, why should I care what nursing homes are paid? More than 33 nursing homes have closed since 2014 in our state, with over 1,600 nursing home beds permanently closing. This means that at some point, you may be faced with a loved one traveling several hours away to a nursing home. Your parents or grandparents could be denied admission to a long-term care facility they prefer or forced to move far away. Hospitals are in gridlock because they cannot discharge patients who need long-term care or short-term rehabilitation due to the lack of bed availability in nursing homes. These patients are taking up hospital beds from new patients who need them. Across New York State, people are spending 4 hours or more waiting in emergency rooms, the 6th longest wait time in the country. You or someone you know may be unable to get care at their hospital of choice. We have been experiencing natural disasters of epic proportions across our country, such as Hurricane Helene and Milton. We are now faced with a disaster created by New York State that is already impacting older adults across the state. This situation will only get worse without your help. And now on this graphic, you're going to see a depiction of a number of holes in the Medicaid crisis created by New York State, this New York State disaster, man-made disaster that they've done. One of them is this 10% cut in capital reimbursement. So in the middle of this crisis that we have, New York State also has decided they're going to cut capital reimbursement to nursing homes. Many organizations may decide they cannot afford to invest in their facilities anymore because of cuts like this. What do we need you to do? Contact Governor Hochul and your local state representatives. Use the information at the end of this communication and please share with others. Older adults and the people who care for them are depending on your help.